Thank you so much, Godfrey. Well, this is a very serious conversation that we love to have on Bahamas at Sunrise as we continue to talk about how we can be our healthiest selves. High blood pressure or hypertension is when pressure against the blood vessel walls in your body is consistently too high. Here to talk with us about this, we are very happy to welcome Dr. Frederick Smith. He's an internal medicine specialist and a nephrologist with Doctors Hospital Health Services. Good morning, Dr. Smith, and welcome back to Bahamas at Sunrise.
Good morning, and thanks for having me again. It seems like it's home now.
Yeah, it is home for you because we can't not do this as often as we do, right? The numbers speak too highly in the country for those of us that have hypertension, and I almost think, Dr. Smith, that some of us automatically expect it, right? Like, oh yeah, that's just going to be a part of my life because my mommy had it, and my grandma had it, and my granddad had it. When it doesn't
hmm
have to be. So
And,
let's
and that's what I was going to say. It doesn't have
yeah,
to be because,
it
there's nature versus nurture. And there's some
right.
things that we can do to help to prevent that.
Yeah. Yeah. And I love that you said that. So we're going to talk about that today. Let's get started by understanding the cause, and then people can kind of start to see exactly that point, right? That they get to make some choices. So, what causes hypertension?
And I think that you've done a good job at starting to give us a little bit of the pathophysiology behind it because hypertension truly is a blood vessel problem.
Mm-hmm.
Hypertension, again, is an increase in pressures in the blood vessels. And
Mm-hmm.
so you've done very good at that.
Mm-hmm.
I think if you want to go to a little bit more about what causes it, there are numerous things, and we're going to call it multifactorial. It can be
Mm-hmm.
there's some nature versus some nature things,
Mm-hmm.
whereas there are some elements of a genetic predisposition to it. But there are also some nurture things. There's some
Mm-hmm.
nurture things in our diet, i.e., the amount of salt that we eat. There's the nurture things in terms of the amount of exercise or the lack thereof that we do. So we end up becoming a little, as I think the term now these days is a little fluffy, and we become a little fluffy, and with the weight, then we increase the pressures or the pressure loads as well. So there's weight, there is nutrition, there is diet, there is exercise, and we're going to call it lifestyle changes.
Mm-hmm.
So
Mm-hmm.
there's some things in our lifestyle that can do it a little different.
Okay. And then are there symptoms of it? Like can people, if you have a pink eye, it's pink, right? And you can tell. Or if something's perhaps wrong with your gastrointestinal system, you might go to the bathroom too frequently or too little. So there are like some things that you can see. With hypertension, is there anything that stands out as a symptom where people may notice this might be a sign of HD happening?
So there are some. I'm going
Mm-hmm.
to start by saying that, sometimes people become dizzy, sometimes they'll have headaches.
Mm-hmm.
And I don't know why this happens, but some other older folks get pain around their back. I got that from an older physician, and same to
Mm-hmm.
them too. They may start to have other things that suggest that other organs are giving them problems. So they may start to have blurring of the vision or pain in the eyes. They may have chest pain, racing of their heart, swelling of their feet. So it may go in to start to say their heart problems. It may go into say the now that their kidney problems. Go into saying now that there are things that are going on in your mental system or your neurologic
Mm-hmm.
system. But
Interesting.
I think what we have to also very much highlight is hypertension is also known as the silent killer.
Wow.
So sometimes there is nothing at all that you yourself realize is going on. And then you go just for a checkup and you realize that your blood pressures are high.
Wow.
Yeah. So
Okay.
symptoms, there are some symptoms, there are some signs. But again, what we must remember is if you don't check it, you'll never know because it is also known as the silent killer.
Wow. And so is it then important to get regular screenings? Because that concerns me. The Bahamian diet is salty, period. And so I'm nervous about that for those watching. Should you just be doing regular checkups? I know lots of organizations pre-COVID would have these screening events at different fairgrounds, etc. Is that something that people should be doing regularly? And is there like an age range for that? Can you give us some more context about how we could check then for the silent killer?
So I'm going to tell you that according to our age, there are some parameters in terms of what we must do and how often we should have our annual physicals. And I know
Mm-hmm.
Doctors Hospital Health System has that set up. We have Prime Care with Dr. Warner Rogers is in charge of, or the director, to be more politically correct. And I think that there is the role that we should continue to do our physicals yearly because we
Mm-hmm.
may pick it up.
Mm-hmm.
Now, against the guideline a little bit.
Mm-hmm.
And some of the things that I do, well, every time somebody comes into my office, we check blood pressure. In
Okay.
fact, in our home setting, we have blood pressure. I have a blood pressure monitor. I try to get my mom to check her blood pressure twice a day. God help
Mm-hmm.
me, she doesn't always do it, but that is the kind of thing that we'll do. So even preventatively, not
Mm-hmm.
guideline. The machines are $30.
Mm-hmm.
Why not
Mm-hmm.
get a machine and every so often in your family, it becomes a family affair. Just
Mm-hmm.
how it was in the churches, as you said, pre-COVID. A lot of churches did the fairs and they did the
Mm-hmm.
screenings there where nurses
Mm-hmm.
would come in and do the blood pressures and do their finger sticks to look for diabetes. How hard is it for us to get a $30 automatic machine and put
Mm-hmm.
it on that ones and check it? So I think
Mm-hmm.
that that is something that we can start to do. And again, not guideline, but I think it's a wonderful idea.
Okay. Are there many people walking around undiagnosed?
Absolutely.
Mm-hmm.
Absolutely. In fact, what we do find is that a lot of the persons that come in are incidentally found to have high blood pressures when they come into their physicals or they come in for another complaint and it just
Mm-hmm.
becomes a part of the screening when you come in, or as we say, the vitals when they come in
Mm-hmm.
to see the physician and we notice that their blood pressures are above the recommended guidelines, whether it's American guidelines, British guidelines, but they're elevated and then we start to investigate for it.
Okay. Now, is there treatment for hypertension? And with everybody who's, comes in, they've got high blood pressure today, does everyone need medication? What are some of the alternatives if there are some people who would prefer not to be on medicine?
So that because I'm gonna say be careful because it becomes a slippery slope because a lot of
Mm-hmm.
us will prefer to drink the bush teas and do the bush medicine rather than taking a medication.
Uh-huh.
But and I say slippery slope because if the physician prescribes it, even if you
Mm-hmm.
do things along with it, then one should take the medication.
Okay.
So does it always take treatment of medication? Sometimes you can make changes in your blood pressure with your lifestyle changes. You can
Mm-hmm.
increase your exercise, you can increase intensity of exercise, you can change your diet, changing diet as well as decreasing the amount of salt, and they may do some differences. You can
Mm-hmm.
lose weight, and we know that if you lose weight, it can drop the systolic, new word, systolic blood pressure, which is the top number. New word, diastolic blood pressure, which is the bottom number. So we know
Mm-hmm.
that exercise alone can change that by a certain
Mm-hmm.
amount. We know that the decrease in salt alone can do that.
Mm-hmm.
We know that weight loss alone can do that. So
Mm-hmm.
that's three things that become summative as opposed to just that just individually doing it. So that means that you have an exponential ability to decrease your blood pressure just by doing those three things.
Mm-hmm. Mm-hmm.
And so, we talked about yesterday being Father's Day. Happy belated Father's Day to everybody that's a father figure,
Mm-hmm.
the whole spiel. But there was crab and rice.
Of course. Of course.
There was macaroni.
Mm-hmm.
There was peas and rice. There probably
Mm-hmm.
was potato salad, fried fish. And truth, all of that, we actually put a good bit of salt in to get the flavor that we like as Bahamians.
Okay.
So decrease the volume,
Mm-hmm.
decrease the amount of salt, and then do a little
Mm-hmm.
exercise afterwards. And you've
Mm-hmm.
met three things that should help to
Mm-hmm.
decrease your blood pressures.
Excellent, excellent. Well, Doc, thank you so much for coming in and sharing with us. I think you've given us very clearly three options that can help, even if you are predisposed to this. And then I love that you said, that those blood pressure machines are available. They're available at many of the pharmacies. They only cost about $30. And so if you can take that and do that preventatively, you can be on the right track. So I think we learned some great information from you today, Dr. Smith. And we thank you so much for joining us this morning on Bahamas at Sunrise.
Thank you very much. See you again next time.
You're watching Bahamas at Sunrise. We'll be right back.